What is ataxia? Have you ever noticed your pet moving in an unusual way, like stumbling or having trouble standing? This could be a sign of ataxia, a condition that affects coordination. Ataxia is a neurological issue that leads to a lack of voluntary muscle control. This means that your pet may struggle with movements in their legs, head, or body due to problems in the nervous system. When the communication between the brain and muscles is disrupted, it can result in abnormal movements. There are different types of ataxia that can affect pets. Proprioceptive ataxia is one type, which happens when there is damage to the spinal cord or brainstem. This can make it hard for dogs to know where their limbs are positioned. You might see your dog dragging their paws or having trouble balancing. Common causes include spinal cord compression from intervertebral disc disease, tumors, or nerve problems. Another type is vestibular ataxia, which is linked to issues in the inner ear or brainstem. This can disrupt balance, leading to symptoms like head tilting, circling, or falling to one side. Ear infections or inflammation are often the culprits here. Cerebellar ataxia is caused by damage to the cerebellum, the part of the brain that coordinates movement. Dogs with this type may take exaggerated steps, have a wide stance, or sway while walking. They might also show rapid eye movements, known as nystagmus, and struggle with sudden turns or stares. When it comes to how ataxia presents itself, affected dogs may have a drunken gait, stumbling, or falling. The severity can vary from mild clumsiness to being unable to stand at all. Symptoms often worsen during quick movements or complex tasks like climbing stairs. Veterinarians will typically assess your pet's gait, limb placement, and balance to diagnose ataxia. They may use neurological exams, imaging techniques like magnetic resonance imaging or computed tomography, and tests for infections or metabolic disorders. It is essential to differentiate between the types of ataxia for effective treatment. Treatment options depend on the underlying cause. For spinal issues, surgery or anti-inflammatory medications may be necessary. Ear infections can be treated with antibiotics or antifungals. Unfortunately, cerebellar degeneration often does not have a cure, but supportive care can improve your pet's quality of life. Recovery from ataxia can vary widely. Acute causes like infections may resolve with treatment, while chronic conditions, such as degenerative diseases, may require long-term care. Early intervention is key to improving outcomes. As a pet owner, it is important to monitor for sudden changes in your pet's gait or head position. Avoiding stairs or slippery surfaces can help prevent injuries. If you notice any symptoms, consult a veterinarian right away, as prompt diagnosis is vital for effective management. To understand some terms related to ataxia, proprioception refers to the body's ability to sense where limbs are without looking. Nystagmus is the term for involuntary eye movements that can indicate vestibular or cerebellar issues. The vestibular system includes structures in the inner ear and brain that help maintain balance. Understanding ataxia can help you take better care of your pet's health and wellness. If you notice any concerning signs, don't hesitate to reach out to your veterinarian for advice.